Canada's National Advisory Committee on Immunization has released its recommendations on the COVID-19 vaccines in the fall.
These are pretty good recommendations in the sense that they're pretty clear as to acknowledging that COVID is obviously still here, that we're likely to see a resurgence of cases as we move through the summer and into the fall.
For those who have previously been vaccinated against COVID-19, NACI's recommending Canadians get the booster in the fall if it's been at least 6 months since an infection or a dose, saying the boosters will contain new upgraded formulas targeting the most recent immune-evasive variants. Experts reminding Canadians that COVID is still here and people are still vulnerable.
Including vulnerable to more severe manifestations of the virus. I like how they really teased apart different groups who are at greater risk for more severe manifestations of the virus and made a stronger recommendation that those individuals get the vaccine. That's obviously very smart. And, those include people who are, for example, over the age of 65, people with underlying medical conditions, people in, for example, long-term care facilities, Indigenous communities. There's a few others.
The committee is also strongly advising anyone 5 years of age and older who has yet to get vaccinated get the primary 2 doses of mRNA vaccines, and a quote discretionary recommendation for children 6 months to 5 years of age who have yet to be vaccinated to also get the primary 2 doses of an mRNA vaccine. Experts reminding Canadians the virus hasn't gone away.
It's going to continue to circulate. Sometimes there'll be more of it around, sometimes there'll be less of it around. Fortunately, right now, there's less of it around in the summer in Canada. When these new vaccines are here, especially in the fall, it is important for people, especially those who are at greater risk for severe infection, to go get that vaccine. It can certainly mitigate severity of infection. It certainly can keep people out of hospital. It can prevent severe manifestations like death as well.
For City News, I'm Faiza Amin.